Volunteers. This is one of my favorite categories of our team, probably because we're unique in the fact that we're the only healthcare entity that the federal government mandates that we have volunteers. In fact, 5% of our staff hours have to be volunteer hours. So people say, well, what in the world does a volunteer do with patients that are facing the end of their life? Well, they can do very practical things. They can help caregivers and provide relief for them. They can, read to a patient that was an avid reader and now is just too weak to be able to look at the reading and the writing, read the newspaper, write letters, run errands for the caregiver, or sit with the patient when the caregiver gets a little break. They can provide the very important social interaction for the resident and family, provide reassurance and comfort, support in the active listening process, and companionship. We had a volunteer that was new and was going out to their first patient, and she was an adorable little woman who would sit up in the chair next to the window whenever he came. And he was taught to kind of do whatever was necessary. Well, he kept asking questions, can I do this for you? Can I do that for you? And she kept just shaking her head, no, 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 dear. No, no, you don't need to do that. No, no. And he was very frustrated. So finally he remembered the part of training where we say, just observe the patient and what they're doing. And he was sitting there one day and he noticed after a couple of visits that she kept looking out the window and looking very sad. So finally, he reflected that back to her. You know, I can't help but notice you look out the window and look very sad. And she said, you know, I've lived in this house for 30-some years now. And every spring I've gone out and I've planted my favorite flowers in that garden. And I know I'm dying and I know that's difficult and I have a lot of loss issues. But it seems probably silly to you, but one of the hardest things I'm dealing with right now is that I'm not out in that garden creating that beauty. Well, the light bulb went out in the volunteer's head, and they soon got to planting that garden. And on his next visit, he brought in flowers and sat out there. It was warm enough now they could crack the window open a little bit, and she was able to direct him where she wanted those flowers. And that volunteer helped complete a very important part of life for her in making that yard beautiful. And that helped her in her quality of life for those very important days. What are other hospice services? Sometimes we need dietary counseling. We always have the availability of bereavement counseling. Sometimes patients might need physical, occupational, respiratory, or speech therapy. That's all available. And sometimes, I mentioned, we have alternative therapies that can be available for a patient. Music or art therapy, aromatherapy, and even pet therapy or massage is sometimes provided by hospices. Bereavement services. I want to spend a little extra time on this because a lot of people think that bereavement services must start once an individual passes. That's wrong. Patients and families experience loss at the end of life on a daily basis. They grieve the time that comes when it's the last time the two of them might be able to attend a concert. They grieve the last time that they may be able to sleep in the same bed because now the patient needs a hospital bed. There's constant grief and mourning that goes on, and that's why it's so important for our team to be able to continually assess and evaluate and provide support for the patient and family. Obviously, we're there for that family once the patient dies, and we care for that family for at least a year with our bereavement services. We have bereavement groups that they can attend. We send out bereavement mailings and cards. We do follow-up phone calls. We actually can do bereavement counseling. And then most of hospices also do an annual memorial service, etc. So that it's a time that we're not forgetting about their loved ones. We're remembering them and remembering them that it's important to remember and honor someone that you've loved and treasured so. That's hospice, and that's why I love hospice, and that's why I can't ever see leaving hospice. But let's talk about the practical matters of hospice, like who pays for it? Well, Medicare covers it. Medicare Part A is a coverage for hospice. Medicaid in most states covers hospice. More and more HMOs, health maintenance organizations, are covering hospice, as well as the new senior HMOs. And other insurance, as well as some patients will even pay privately if they're able to afford it, are put on a sliding fee scale if they have some limitations, or if they can't pay at all, we still take that patient and family. In other words, it's important to know that a good hospice will always provide care regardless of insurance coverage or the ability for an individual to pay for that care. So it shouldn't be a burden and it shouldn't be a worry at all. The Medicare hospice benefit, I think, was one of the best things that the federal government ever did for healthcare. It was passed by Congress in 1982, and it was a Part A Medicare benefit. As I mentioned, it covers 100% of the costs related to the terminal diagnosis. It's now an unlimited benefit with unlimited numbers of benefit periods, and the services are primarily reimbursed on a per-day basis. So what does that include? It includes the visits from all those people that I've already covered, our entire interdisciplinary team, as well as our volunteers. It also covers all the medications, medical supplies, medical equipment, any inpatient care that's needed, bereavement care, and 24-hour on-call availability. And again, all of this is provided based on the patient's unique needs. So the interdisciplinary team, working with the patient and family, evaluate what is necessary to provide the highest level of quality of life at the end of life. There are 4 levels of hospice care, and they're all paid for differently. Most of our care is what we call routine home care. I would say probably 85 to 90% of all hospice days in this country is routine home care. And that's where we visit the patient wherever their residence is. They may, again, remember, live in a skilled nursing facility, live at home, live with a friend, be homeless and live on the corner. That's where we go to provide that care. We would, I would say, on average across the country, it varies based on your wage index from which you are providing that care, but I would say probably about $150 a day. And remember, going back to that previous slide, it covers all that for that dollar amount, except for the inpatient care.